Very good. So we are getting started with Welcome to Medicare. Today is January 12th, 2026. So this information will be about Medicare 2026. My name is Jim Brikita. I'm the Managing Director of Health Services here at the Entertainment Community Fund. And we're just going to tell you a little about the Community Fund, the Entertainment Community Fund, and then I'll take you through the different parts of Medicare. And we'll go into a fair amount of detail. But it's going to be a rather high level sort of overview of what Medicare is. So let's get the slides to move here. Where are the slides? There we are. So a little about the fund. You know, we are a national human services organization, social services organization that supports everyone in the entertainment industry. We used to be called the Actors Fund for almost 100 years. We changed the name a couple of years ago because we actually deal with everyone in entertainment, musicians, agents, producers, tech people, all sorts of individuals in entertainment. And we provide a whole suite of services. In addition to health insurance counseling and health insurance information, we do financial assistance, we do housing support, we run affordable housing projects, both in New York and California. We have a career counseling center. We do support for seniors. We run the nursing home in Englewood, New Jersey. We do support for kids. We do a whole bunch of other stuff. So if you ever need stuff like that, please rely on us. If you could mute your mic, that'd be great. Thank you. Someone else is coming into the waiting room. Very good. We on my team are the health services team, and if I can get the slides to move, there we are. Health services, we do, in addition to Medicare counseling, we do counseling for marketplace individuals on the Affordable Care Act. We do these webinars. We do the Welcome to Medicare webinar every Monday. Every other week, we do one on marketplace. And of course, you can always set up a one-on-one counseling session with one of our enrollment experts. So feel free to fill out the username and password on the portal on our website, and you can request a counseling session, and we'll do a one-on-one counseling session with you. In addition, our webpage, which is there at the bottom, entertainmentcommunity.org/AHERC. AHERC stands for Artists Health Insurance Resource Center. We have a bunch of stuff on the page, educational materials and videos that'll help you with health insurance topics. And we do a fair amount of advocacy with the legislature here in New York for things like the COBRA subsidy program, which is available to entertainment workers, etc. We work for health justice and health equity, especially for those in the entertainment industry. So let's get started on Medicare. What is Medicare? Medicare is health insurance for people over 65, right? People under 65 can also get Medicare if they have certain disabilities. People with end-stage renal disease or certain disabled people can get Medicare. But typically, it's the insurance that's available to you once you turn 65. So just some basic nomenclature to get started, just Medicare vocabulary 101, right? When you turn 65 and you sign up for Medicare, you're going to sign up for Part A, the hospital part of Medicare, and Part B, which is the medical part of Medicare. So you're going to get a red, white, and blue card from the government. This is provided by the federal government. It's called Original Medicare, and it has Part A and Part B. And like I said, we're going to go into the parts a little more deeply. Once you have Part A and Part B, people like to add additional coverages, or they try to add additional coverages to support their original Medicare. One way to do that is to get a Medicare Supplement plan, also called a Medigap plan, which covers what original Medicare doesn't. And some people get a Medicare Advantage plan. The Medicare Advantage plan system is sometimes called Part C. These are plans that are provided by private insurance companies, and they wrap around Medicare. A couple of other things just to pay attention to. Part D is the Medicare Prescription Drug Plan. So that goes along with a Medicare Supplement plan. If you get a Medicare Supplement plan, you're going to get a Part D drug plan. Initial enrollment period is when you first turn 65, you have a 7-month window to enroll in Medicare, which there's a future slide on this that I'll discuss that. There are also certain special enrollment periods throughout the year or you can change plans or sign up for Medicare or sign up for different parts of Medicare. And this happens usually when changes happen in your life, right? You have a change in your coverage or some change in your status, or your life happens, you get a special enrollment period to adjust your coverage. And then once a year, there's something called a general enrollment period. We're in it right now from January 1st to March 31st. During the general enrollment period, if you have an Advantage plan, you can change your Medicare Advantage plan. You can also return in the general enrollment period, you can return to what's called original Medicare. So Medicare begins when you turn 65. It begins the first day of your 65th birthday month. If your birthday is the first of the month, it begins the first day of the month before your birthday month. For most people, if you're getting Medicare eligibility because of a disability, it begins 24 months, 2 years after you start collecting your Social Security disability insurance. When you turn 65, if you're already collecting Social Security, you are automatically enrolled in Part A and B. There's a little nuance to this because the Social Security retirement age has changed. So at 65, you can enroll in Medicare, but certain people now that we're into the 1960 birthday year for turning 65, I think certain people have to wait till 67 before they're automatically enrolled. But you generally, if you're collecting Social Security, you'll be automatically enrolled. If you're not automatically enrolled, you have a 7-month window called your initial enrollment period. The 7-month window to sign up for Medicare begins 3 months before your 65th birthday month. It includes the month of your birthday, and it stretches for 3 months after your birthday month. They do incentivize you to sign up in the 3 months before your birthday, because if you sign up in the 3 months before your birthday, you're going to get that coverage that starts on the first of the month you turn 65. If you wait till after you've delayed your coverage, you may have gaps in your coverage. So best to sign up in the 3 months before or your birthday month if you can. When you sign up for Medicare, you sign up on the Social Security website. It's listed here, the ssa.gov website. There's a button there that says sign up for Medicare. You can go on there, and it's relatively easy to sign up online. You can also do it at the Social Security office if you wish, or you could do it by phone, although people do report long wait times, for Medicare if you do it by phone. Sorry, I just want to move into the next slide. Okay, so here's a little visual about that 7-month waiting period, right? So if you sign up in the 3 months before your birthday month, it'll start the first of the month. There's 65, and if you sign up after, the coverage will begin the month following the month you enrolled. And during this initial enrollment period, you can sign up for Part A, you can sign up for Part B. Part A is the hospital, Part B is the medical. You can sign up for a Medicare Advantage plan if you have Part A and B. You can sign up for a Part D drug plan if you have Part A and or Part B. And you can sign up for a Medigap policy. And I'm going to go through each of these different parts of Medicare as we go forward. So, as I just said, Part A. Part A is the free part of Medicare. When you turn 65, you can sign up for Part A, and this is the hospital inpatient insurance. Part B is the medical part of Medicare, right? This covers doctor visits and etc. Part B has a premium that we'll talk about. And that Part A and B that come as that first red, white, and blue card you get when you turn 65, those are called original Medicare. Part D is the Medicare prescription drug coverage. In addition to Part A, B, and D, there's Medicare Supplement Plan or Medigap plans, which wrap around Medicare and provide additional support. And there's the Medicare Advantage Plans. Medicare Advantage Plans are sometimes referred to as Part C Medicare. So Part A. Part A covers hospitalization, right? So inpatient care in a hospital, skilled nursing facility care, which is rehab care. It also covers some home health care, and it covers hospice care. Part A relies on something called a benefit period. So you'll see in the next slide, there's some talk about what are the costs on Part A. Part A doesn't have a premium, so it has no monthly cost, but there are some costs. Those costs are connected to a benefit period. And a benefit period begins the day you're admitted to the hospital, and it ends when you've gone 60 days without being readmitted to the hospital. So if you're in the hospital for 10 days or something, and then you go 60 days without being readmitted to the hospital, your clock starts again on the benefit period, and you have a new benefit period. That's important because the deductible resets on the benefit period with Part A. So the cost that you would have with Part A, you don't have like I said, it's free. You don't have a monthly premium, right? Part A for citizens of the US who have worked at least 10 years, 40 quarters of work in the United States where they put Medicare taxes, where they paid Medicare taxes, it comes with a $0 premium. It's free. Other costs on Part A, if you have a hospital stay, each benefit period has a $1,736 deductible. So you have to pay the deductible first, and then you'll get $0 a day until the 60th day of your hospital stay. If you stay in the hospital longer than 60 days, for days 61 to 90, there's a $434 copay per day for those days. If you're in a skilled nursing facility, a rehab facility, it's $0 for the first 20 days of each benefit period. But after you exceed 20 days, there's a per day charge of $209.50 for your skilled nursing facility care. And hospice care is a $0 copay, except there is a copay of up to $5 per prescription for pain management. And we'll talk about these costs and how to manage these costs, right? Because most people think Part A and Part B or Medicare comes without cost. There are costs involved, but there's ways to manage those costs. Part B. Part B is the medical portion of Medicare, and it covers things that are not in a hospital, right? Services from doctors and specialists, covers all the things on this list: mental health care, preventive care, home health care, tests, lab services, etc. Physical therapy, occupational therapy. Part B does not cover the things on this list, right? It does not cover long-term care. It does not include dental or vision care. It does not include hearing aids and exams. It does not include acupuncture, and it does not include cosmetic surgery. There used to be a joke about Medicare not covering things above the neck, right? So teeth, eyes, ears. And that's still true. There is some talk about adding a dental coverage to Medicare, but that hasn't happened yet. There are some costs associated with Part B, right? Part B has a premium. Unlike Part A, which is free, Part B has a monthly premium. For individuals who make under $109,000 a year, the premium is $202.90 per month for 2026. If you're collecting Social Security, they will take this $202 out of your Social Security check. Part B also has a deductible. The deductible for 2026 is $283. So for most Part B services, you can think of it, and you can think of the A this way too, right? For most A and B services, Medicare pays 80%, and you're responsible for the other 20%. And we're going to talk about what to do about that in a second. But generally, Medicare pays 80% of your charges. Things that come without costs on Medicare Part B, most lab and blood work, screening tests, vaccines, preventive services are all covered at 100%. Medicare.gov is a terrific website. It's easy to use, and it does have a list of the services that are covered at no cost to you. Sorry about that. So when do you enroll in Part B? Unless you're still working, you're going to usually enroll in Part B when you enroll in Part A. That is during that initial enrollment period. So during that initial enrollment period, you're going to enroll in your A and your B Medicare. If you don't enroll in Part B, right? Some people, I was just dealing with a client who didn't enroll in Part B. There is a penalty that they assess. So if you wait past your initial enrollment period or when you're eligible to enroll in Part B, there's a lifetime penalty if you don't sign up in time. So pay attention to that and sign up for Part B when you're first eligible. If you're enrolled in group health insurance, employer or union health insurance, or you're covered by your spouse's current employment, you can defer Part B, right? You don't have to enroll if you're covered, but you do have to pay attention. And I have a slide on this too. You do have to pay attention. If your coverage ends, you have to sign up for Part B, right? If your coverage ends, you have an 8-month, what's called a special enrollment period to sign up for Part B. Let's talk about this because it's a little bit complex, right? If you're still working and you're covered by your employer or your union when you turn 65, you should definitely get Part A. Part A is free. You can just sign up for it. They send you a card. It's fine. But if you're still working, you can wait to enroll in Part B. When can you enroll in Part B? You can enroll while you're covered, while you have your union plan. You can enroll in Part B anytime, as long as you're covered based on your current employment. Although you are paying then two premiums, right? You'd be paying your employer premium and you'd be paying your Part B premium. Or you can enroll after your coverage ends, right? When your coverage ends, you get an 8-month special enrollment period that starts the month after your coverage ends or after you stop working, whichever comes first. This becomes a little bit of a problem in the entertainment industry because some people stop working, but their union coverage extends for more than 8 or 10 months into the future. If that happens, you have to pay attention, right? Because you only get 8 months after your last day of union covered work to sign up for Medicare Part B. If you wait till the end of your coverage, sometimes you can sign up for Part B. I know that Actors Equity, Screen Actors Guild kind of allow you to sign up after your coverage ends, but some of the IATSE plans track it to the last day you worked, and it can be problematic if you don't pay attention to that last day you worked. Generally, you can think of it as, once your coverage ends, you have 8 months, but if you're in one of the IATSE National Benefit Fund plans, especially, make sure you pay attention to that last day of work. You can't use this special enrollment period if the health plan you're on ends during your initial enrollment period. The initial enrollment period always sort of coos the special enrollment period. It's more important and it takes precedent over the special enrollment period. So if I'm working, do I need to sign up for Part B? There's a little chart here, right? If you're turning 65, if you're covering just yourself, that's that purple row there, right? If you're covering just yourself, and the plan at work is comparable in cost and coverage to Medicare, you may not need to get Part B. You can stay on your work plan and defer Part B. But if it's not, if the coverage or the cost is greater, you may want to investigate Part B and the wraparound coverages like a Medigap or a Medicare Advantage plan. Part D. Part D is prescription drug coverage. This is prescription insurance, and unlike Parts A and Part B, Part D is only sold through private insurance companies. So you have a choice of a lot of different plans. And the best plan for you is going to depend entirely on what your prescriptions are. You can go into Medicare.gov, enter your prescriptions, and it will give you a list of plans that cover those prescriptions in price order, and you can usually pretty easily find a Part D plan. Part D plans are modestly priced. You do have a monthly premium for your Part D. There are some deductibles and copays to consider when you get a Part D plan. We'll talk about the costs on those. Here's the cost. The premiums for 2026 for Part D drug plans. The average premium is about $39, right? The least expensive premium in New York City right now is $35.70. The least expensive premium in Los Angeles is less than $12 a month. So you're getting some pretty reasonable coverages, especially on the West Coast. There is a deductible on Part D. It's $615 for 2026. The deductible does not apply to generic drugs, right? It only applies to non-generic or brand name drugs. And then there are copays, which vary depending on the cost of the drug. You may get a cheaper cost at certain pharmacies, etc. There is a Medicare Health and Drug Finder on Medicare.gov. It's an excellent resource for finding the best plan. You can just search, put in your drugs. It'll save, if you have an account on Medicare.gov, it'll save your prescriptions. So every time you log in, it has a list of your prescriptions, and it'll direct you to the lowest cost Part D plan. Some changes. Actually, the second one isn't a change for 2026. The first one is, though. For 2026, there is this is for prescription drugs. There is a $2,100 out-of-pocket limit on your prescription costs, right? So $2,100 is the most you're going to spend in a calendar year before that prescription drug plan has to pay 100% of all costs. Your costs essentially for prescriptions are capped at $2,100. You won't pay anything else after you've paid $2,100. You won't pay anything else for the rest of the year. Medicare, this happened in 2025, I think, the prescription payment plan. What they'll do is they'll take your yearly prescription costs and they'll amortize them over a 12-month period. So for instance, instead of you say you get your most expensive drug once a year in February, instead of having a giant bill in February, what they'll do is they'll take the yearly drug spend and they'll allocate it over 12 continuous months. So you have a standard payment every month. So instead of paying, as an example, $1,200 in February, you'll pay $100 a month from January through December. If anybody lives in New York, Con Edison used to do this with electric bills. They used to standardize your cost and put it like you had the same charge every month, because people would run their air conditioners in the summer and they'd pay more in the summer. They would let you pay the same price every month. So once you have original Medicare, right? This is the part that I think is most confusing in the beginning for people. Once you have your original Medicare, you have your A and you have your B, right? And that pays 80%. What do you do about the other 20%? How do people solve the problem of paying that other 20%? Well, there's two ways to go, right? The first way on the left is you have your Medicare Part A and B, and then you get what's called a Medicare Supplement plan, sometimes called a Medigap plan. And then you get a Part D drug plan. So in that scenario, you have A and B, you have your Medigap, and you have your Part D. Medigap, of course, why is it called Medigap? Because it fills in the gap around that. It fills in that gap of 20%. It pays all your additional copay costs. The other way to go is you can have your Medicare Part A and B, and you can sign up for a Medicare Advantage plan. Medicare Advantage plans, sometimes called MAPD plans because they include prescription drugs. Medicare Advantage, prescription drugs, MAPD. So let's talk about these two roads. That first road, Medicare Supplement or Medigap plans, they cover the costs that are not covered by original Medicare. So they will cover that 20% copay. They'll cover your coinsurance. They'll cover that Part A deductible. The Medigap plans, they're 8 federally standardized plans to choose from. They're named after letters, confusingly, right? A through N. And they're sold by private insurance companies, but they're heavily regulated by the government, right? Each standardized Medigap plan, so Plan A, Plan B, Plan N, Plan F, Plan G, they all have to offer the same benefits, no matter which insurance company sells it. So if you're looking for a Part G plan, Part G is the strongest of the Medigap plans. It covers the most. It has the most comprehensive coverage. Even though insurance companies can charge different prices, they don't give different benefits. All G plans are exactly the same, which of course then people gravitate toward the lowest cost carrier in the area, which only makes sense because the benefits you're getting from a higher cost carrier they're not any better, right? There's a chart. This is one version of this chart. There's a bunch of these out there. This will show you can see the chart on the left side of the chart. There's a column that lists the type of service that's covered. And as you move across to the right, you'll see the letters across the top, A through in this case, F, right? The letters are not in order. There's letters missing. This is because of legislation and plans dropping out and what have you. But these are the letters we have. So this is what we have. If you want to look at like what's the best Medigap plan to get, right? You'll see that the check marks indicate which services are being covered by each of the letters. G, that plan G, which is the one, two, three, fourth column over, is the one with the most check marks, and it covers the most stuff. So on the left side, you'll see that the Medicare Part A, coinsurance, and hospital coverage, right, up to an additional 365 days. Remember, Part A had that charge. If you went over 60 days, it had a daily charge. The G plan will pick up that daily charge. The coinsurance for Part B is 20%. You'll see that most of the plans pick up that 20%. A K plan or an L plan will pick up a portion of that 20%. So under K, you'll see that for the Medicare Part B coinsurance, the K plan pays 50% of the 20% that you're paying, right? So you're still on the hook for 10% of the costs. Medicare doesn't, for some reason, cover the first 3 pints of blood you get in a hospital. These plans will all cover that. Hospice care coinsurance, services that are in a nursing facility, etc. So what you want to do if you're going to go this route is to make sure, see what your needs are going to be anticipated to be, see what the premiums are for the Medigap plans, and then choose a letter that's going to wrap around your Medicare coverage. And again, cost is the only difference between the Medigap carriers, between the insurance companies, right? So once you decide which letter you want, there's no reason to pay a higher premium. You're not getting better coverage by paying a higher premium. Go for the lowest cost carrier. That's going to be your best coverage on a Medigap plan. Or on a letter. Whatever letter you choose the lowest cost monthly premium. Once you're 65 and you're enrolled in Part B, you have a 6-month guaranteed issue period to buy a Medigap plan. You don't have to worry about pre-existing conditions or everything as long as you purchase that plan within a 6-month period. After that, the right to buy a Medigap plan varies by state. In New York, it's very, very flexible. You can buy a Medigap plan anytime. You can switch at any time. In New Jersey, it's a little bit different. You can buy a Medigap plan anytime, but there may be a waiting period for your pre-existing condition. So if you say you have a heart condition of some sort, they can say, well, for the first 6 months that you have the Medigap plan, we're not going to cover any expenses related to that pre-existing condition. Once you're done with that waiting period, they will cover those expenses, but you might have that waiting period in the beginning. California, a little more restrictive, although you can change within 60 days of your birthday, you can change your Medigap plan. You can switch it up. New York, by far, one of the most flexible states in the country when it comes to Medigap plans. Costs for Medigap plans is the premium, right? You're going to pay a monthly premium for these Medigap plans. The premiums vary by letter. The more coverage you get, the more the premium is. So let's look at an example. There's some examples of the lowest cost G plans in these various areas down here. But let's focus on New York just for a second. Here I am sitting in New York, so we'll talk about New York. If you were to get a G plan in New York, the cost for, I think it's United Healthcare AARP, now is the lowest cost carrier. It's $372.50 a month. So what does that mean as far as your monthly costs for Medicare? It means you're going to be paying $372.50 for your Medigap. You're still on the hook for the Part B premium, which is $202.90. And then you're going to have a Part D drug premium. So all in, you're going to be looking at, somewhere in the $600 a month range if you're going this route. So the cost is really maybe a barrier with Medigap plans, although the coverage is very comprehensive. You're not going to have any other, once you pay that monthly premium, you're not going to have any other costs on Medicare. It's going to be a really comprehensive package of coverage. If you're not going to go the Medigap route, you're going to probably get a Medicare Advantage plan. A Medicare Advantage plan is insurance that's offered by private companies. And what it does is it replaces A, the Part B, and the Part D. It wraps it all together and replaces it, puts it all in one place, right? So if you join an Advantage plan, you still have Medicare, but you're going to get your coverage from the Advantage plan, not original Medicare. When you go to the doctor, you're going to give them your Medicare Advantage plan card. Um, Many Advantage plans, there's some good things about Advantage plans, right? But in lots of ways, it's more restricted with regard to coverage. A lot of these plans provide in-network coverage only, kind of like an HMO. So then it becomes important to check your doctors and which Medicare Advantage plans they accept, right? Because you want to make sure that the doctors you're using or the doctors you want to use accept your plan. This takes a bunch of research. And you are at the mercy of if there's a dispute between a hospital system and an insurance company, and there's been a bunch of these this year. There's a few of them active right now. There's one between Anthem and Mount Sinai right now in New York. These things can impact your ability to get care if you're at the mercy of those kind of disputes. Um, the Advantage plans have to cover all the services that original Medicare covers, but they sometimes offer additional services, additional ancillary coverages, little bells and whistles like vision coverage, hearing coverage, dental coverage, gym memberships. They put sweeteners in the Medicare Advantage plans. The thing is, you're living with a little more restriction. The costs on Advantage plans are also a lot lower than on Medigap plans, right? 60% of Advantage plans have a $0 premium. So you're not paying a large premium to have an Advantage plan. And the doctor visits and the specialist visits are often capped at a copay, right? So you see here what you're paying for your services when you get them. These are averages, by the way. These are not across the board. You have to look at your particular Advantage plan, but they will cover services for just a copay. Um, to enroll in a Part D or an Advantage plan, you do that at the same time you enroll in Part A and Part B, right? As long as if you're not working, let's say if you're not covered by your employer, you'd get Part A and Part B, and then you'd enroll in your Medigap and Part D, or you'd enroll in your Advantage plan. If you don't enroll during that time, then you have to wait till the fall. You have to wait till the open enrollment period, which is from October 15th to December 7th. And at that point, you can navigate into the system. If you go into the system late, right, if you don't enroll in a Part D when you first get Medicare, they do levy a penalty. It's a modest penalty, but they do levy a penalty. You get a late enrollment penalty. The way they calculate it is it's 1% of the national average Part D premium, which is right now around 39 cents a month. So for every month you delayed enrollment. So that's not that much. I mean, it's about $6 or $7 a year. But there are people who, sign up for Medicare and say, well, I don't take any drugs, so I'm not going to sign up for a Part D plan. If you're doing that, you do take a risk because this penalty is a lifetime penalty. Your premiums for Part D will always be more expensive moving forward if you wait to get a Part D plan. If you're going to enroll, especially in an Advantage plan, right, you want to check with your doctors. Make sure they take Medicare, first of all, what's called Medicare assignment. If you're going to get an Advantage plan, make sure that they take your exact plan, right? Before you choose a D plan, use that Medicare.gov website, put in your drugs, see which plan offers the best coverage and the best cost for your medications. And it says here a little tip on the bottom. Get a Medicare.gov account and store your drug information there. Medicare.gov, like I said, it's a pretty easy to use website, and I would recommend it as you move forward. So, what are the advantages and disadvantages of these two systems? Medigap plus Part D, right? That first road you might have gone down on the left side of the page here. The upsides of this are it's really comprehensive coverage. It's really covering everything. You're not going to have out-of-pocket costs beyond your premium. The Part B deductible is really the only non-covered cost. The Part B deductible is $283 for 2026. The downside of course, is that you're paying a higher cost. And you don't have those ancillary services, the dental, the hearing, the gym memberships, things like that. If you move to the Medicare Advantage side, you're going to be paying less money, and you may get some additional benefits. And these additional benefits, they're good, but they're modest. They're not going to be as comprehensive as your union dental plan, for instance, but they're going to be there. And the downside of the Medicare Advantage plan is you're dealing with a limited network of physicians in most cases, and it may have limited out-of-state coverage, right? So if you're traveling a lot, you're not going to have as broad a network to use as you would if you had a Medigap plan. Okay, that's the end of the slide deck. So what I'm going to do is let me stop the share.